This week's Journal of the American Medical Association calls on doctors to make greater use of email. In Boston, Healthweek's Alex Gramling looks at the possibilities and the problems of this new approach.
As a businessman, Bruce Friedman uses email every day. As a cancer patient, he also uses email to stay in touch with his doctor.
If I have complaints or something hurts or this or that, I'll email to him, and results of my tests he emails to me if he wants to set up an appointment, or I want to set up an appointment, or I have a question to ask him. I find it a lot easier to do it via email.
Friedman's doctor, Daniel Sands, says email allows him to advise and reassure Friedman in between their regular office visits.
It's a very useful tool in our relationship that sort of says, yeah, I'm still here. And I think it's really a lot more personal in some ways than a phone call.
Studies show patients like the convenience of email, and doctors who use it say it improves their efficiency.
I believe we're all going to be using email in patient care a lot more, both to consult with our colleagues and to consult with our patients.
Right now, less than 5% of doctors exchange email with their patients. But as that figure grows, so do concerns about the possible misuse of this technology.
Some doctors are afraid of being flooded with more email than they can answer. Others say email shouldn't be used as a substitute for seeing a doctor when you need a diagnosis or a prescription. Dr. Kenneth Mandel says there are also questions about privacy on the Internet.
Is it appropriate for a doctor to be discussing something very sensitive with a patient, like HIV status, across the web, when there's even a slim chance of a security breach? I think this is the time to think about exactly that kind of question.
To address such concerns, Dr. Sands has helped write guidelines for doctors on appropriate email use. And he says patients can help minimize email problems by following a few simple rules. Keep your email short and to the point. Don't send urgent or sensitive information by email. Keep copies of all email. And follow up with a phone call if you don't get a response after emailing your doctor. First, of course, you need to find out if your doctor has email. If so, you might find, like Bruce Friedman did, that your doctor is just a keystroke away.